Greetings from traditional osteopathic medicine. I'm Richard Koss, osteopathic physician. The topic this month is carpal tunnel syndrome. Carpal tunnel syndrome is a very common malady that affects many thousands of people every year. The hallmark of this carpal tunnel syndrome is pain and discomfort at the wrist. And in severe cases, this can progress to weakness, pain in grabbing things, and weakness and atrophy of the hand muscles. The first thing to note is that a syndrome is something that is a collection of findings and symptoms that they group together, and they really don't know the cause. And this is no different than carpal tunnel syndrome. It's characterized by this pain and discomfort in the wrist and hand and loss of grip strength. And on severe cases, there will be findings, what's called a nerve conduction study, where they actually measure the impulses of this median nerve going across the wrist into the palm of the hand. When there's congestion, compression, and swelling around this tissue, the nerve itself is dysfunctional. It doesn't pass the signals very fast and very well. Conservative treatment in modern allopathic medicine consists of physical therapy. They might do a steroid shot to decrease the swelling. They will do some splinting of the wrist while at work or at night. And in worst case scenario, when all of this fails and the symptoms persist, they'll actually do surgery. Surgery is very simple. It simply involves cutting and transecting a ligament that goes across this little tunnel, this little valley where the median nerve crosses and goes into the palm of the hand. The thinking is that if you release this ligament, it will open up and allow more fluid and less pressure to pass around this nerve, so it will not be congested and constricted. Unfortunately, this surgery is not that effective. Many cases, the surgery has to be repeated. The other thing that nerve conduction study examiners will tell you, that if they find carpal tunnel in one wrist, within 2 years, the other wrist will be surgerized as well for the same situation. So if the problem is at the wrist, why does the other wrist have to be cut as well? So in osteopathic medicine, we look at this mechanical problem on this median nerve from the entire trajectory of this nerve, from the neck, going under the clavicle, into the armpit, down the upper arm, across the elbow, into the forearm, into the wrist. Any pressure, any restriction, any mechanical problem that might put any slight pressure on this nerve will also give you the hallmark signs of pain and dysfunction and loss of grip strength. There's a lot of problems with repetitive use injuries. A lot of carpal tunnel is done with people who do massive amounts of mouse work with their computers, with poor wrist mechanics. So there's a lot of situations that need to be looked at that might be causative, causing dysfunction anywhere along this median nerve. The other thing, too, that you have to remember is that the median nerve is living tissue. All living tissue has to have a blood supply to keep it alive and nourished. This blood supply also has its own nerve supply that tells the artery when to open or when to close, providing nourishment to this local tissue. Now, a second set of nerves, called from the sympathetic nervous system, comes out of the upper thoracic region around the first, second, and third rib heads at the thoracic spine. Dysfunction here in this area can irritate the sympathetic nerve and actually restrict nourishing blood flow to the median nerve anywhere along the nerve, and especially at the hand and wrist when there's a lot of repetitive use type of work done in this area. So osteopathic medicine, we have several procedures and techniques that will look at the actual trajectory of the nerve from the neck, shoulder, clavicle, arm, forearm, where this nerve runs to free up any tensions, muscle spasms, joint mechanics sets a little bit off, to free that up. But as well, we look at the posturing and the work of the upper 3 ribs, along with the upper 3 thoracic vertebrae, to make sure that the nerve and blood flow to this median nerve to the hand is at its optimum. And so hopefully this is another way that we can help carpal tunnel syndrome. One of my particular diagnostic tools for surgery is that if I put some steady pressure at the back of the rib head, about typically rib 2, right where it meets the spine, if I put some steady pressure on the soft tissue and gently on that spine, if that hand gets numb, reproducing that carpal tunnel symptom, I'm going to tell you surgery is not going to work. And this is in fact the case, particularly in repetitive carpal tunnel surgeries when they're going in for a second and third surgery and it's not working. And so treatment here osteopathically does very good work in helping mitigate some of the other mechanical and physiologic symptoms that can be causing the carpal tunnel syndrome. Then we also give stretching exercises and other postural exercises, looking at the work habits that will hopefully keep this carpal tunnel syndrome away from the surgeon, and which will probably make them mad at me, but my job is not to work from that perspective, because surgery really isn't that helpful in the long run. I hope this is helpful. I hope you have a good day, and everything is going well in your new year in the month of March as we look at problems with carpal tunnel syndrome. Thank you, and have a good day.